This is the Benefits Buzz Podcast, your weekly pulse on what's happening in the world of employee benefits. Brought to you by your friends at WEX, who believe in simplifying benefits for everyone. Now listen up and let's get buzzed. Hey everyone, it is Benefits Buzz time.
We're back. We're back again.
We're back again. I love it. And we've had such a great season so far. And as we roll into May, I'm really excited to bring some much needed attention to May being Mental Health Awareness Month. I'm really excited for this episode, Hayden. I think it's really good for us to put some time and attention because I think we've all felt mental strains in all of our lives. And so I'm really excited for this conversation to dive into how do we address it? What can we do around it? And so I'm really pumped.
I know. I mean, this is such an important topic, but I feel like even more so now than, in previous years, there's just a lot of attention around it. It's always been important, but there's so much attention around this topic right now because we've all dealt with so much change and disruption over the last couple of years.
We have. And as you always do, Hayden, you pulled some really good data here. Since the start of the pandemic, mental and behavioral health requests have increased 100%. And for the youngest employees, that increase was even higher. So, I mean, I think to add some data to your commentary, your anecdote, I think for sure we're seeing this. And so this episode really on how do we stop, mental illness, the stigma around it, and how do we bring it to the forefront and have our conversations. I want to do that. And we have two great, wonderful guests to really talk about how we can do this within the workplace. I want to introduce Marna Canterbury and Joel Spoonheim. Marna is the HealthPartners Senior Director of Community Health and Engagement, and Joel is the HealthPartners Senior Director of Worksite Health and Population Well-being. Marna, Joel, welcome to Benefits Buzz.
Thanks for having us. We also are really glad to dive into this topic and share resources with all your listeners.
Absolutely. Thanks for having us.
Absolutely. We're so excited. Again, this is one of those episodes we can't wait for diving into. When we were doing research, we were talking about some of the guests that we could have on, and we kind of came across the Make It Okay campaign, which is your community campaign to reduce the stigma of mental illness. And so I want to dive into a bit about that, but maybe to start, tell us a little bit about what your organization does and how you're addressing this issue. And that's a good place for us to kind of to begin the conversation, if you will.
Absolutely. Well, I'm going to start out talking a little bit about what Make It Okay is, and a little bit of how that ties to HealthPartners. And so, as you said, Make It Okay is a community campaign. It is sponsored by HealthPartners, and it's been in the field now. Believe it or not, this is our 10-year anniversary because stigma was recognized early on by HealthPartners in our behavioral health settings, and we knew we needed to do something to address it in our communities. And frankly, since then, it has grown and spread nationwide. And we're so glad to share what we've learned with all of you and with the community. Really, the goal of Make It Okay is around that concept you said about stopping the stigma around mental health and mental illness, right? Those silence-inducing conversations where there's hesitancy about how to address, how to be open, and how to get resources. So with a 10-year track record, we've learned a lot. When it comes to our employer groups, of course, they're involved in Make It Okay. But Joel Spoonheim, I'm going to let him comment a little bit more on the important work that's happening there.
Hey, thanks, Marna. Part of what HealthPartners does working with employers is not only providing insurance, but really looking in partnership with those employers to see how we can create a culture of health that improves the outcomes and improves the performance of employees and their families. So that includes addressing head-on mental fitness, mental illness, and the whole gamut of that. And so that includes delivering services digitally, connecting people to care, and we'll get into some of that later. And Make It Okay is a critical part of that work because culture matters. If you want to get people to use their benefits, if you want them to seek care, culture matters. And I look forward to talking more about that today.
Yeah, me too. I mean, obviously, you're covering things from a community standpoint, organizationally, but just thinking about this, even specifically for our audience, just talking about, again, like HR benefits professionals, why do they often approach you? Like, what are some common things that they might say when they first approach your organization about something like this, and what are some of their needs?
Well, you are right. Multiple employers approach us in a number of ways about Make It Okay, and what they're saying is that the silence of stigma is leaving their employees either not accessing the resources and the benefits they have access to, leaving leaders unsure, concerned, and sometimes frustrated about how to manage in systems where mental health and illness just aren't openly talked about. And it can lead to conflict, frankly, and misunderstandings in the workplace. We hear from a lot of employers, either individually, like from Maine to California. We've heard from employers saying, hey, how do we start this conversation up? And Make It Okay is really positioned as a great door opener, like a gate opener for these important conversations. Because it's difficult to talk about the benefits and the resources available to employees through their employee benefit plans and EAPs, et cetera, without being able to have an open, honest, destigmatized conversation. It's also really important that managers and leaders and supervisors understand the resources that they have at their fingertips. Because really, part of stigma is the lack of certainty about how to respond when that conversation starts. And employers say that too, that our leaders just don't know what to say or do when someone says or discloses that they are experiencing mental health concerns, or whether they're displaying those. So starting that conversation is where Make It Okay steps in. What's also really impressive is across the country, employers also increasingly approach us as part of broader community work. So community coalitions that have formed, that have maybe public health and local business, the local hospital, and concerned citizens all working together, because the employees live in a community and the communities also have employers. And so it works both ways, as campaigns that can happen within an employer as well as in the broader world. One really great example of that on a broad scale is, I'm thinking of the work actually that the state of Iowa is doing right now with Make It Okay. They launched their campaign in the entire state all at one time about 3 years ago. They have 88 employers involved in that coalition. And then in other places, we're working with one employer at a time.
Mm-hmm.
So there's a lot of entry points. Joel, do you want to talk more about how you've incorporated Make It Okay?
Yeah, I mean, I'll just be really brief. From a employer perspective, the campaign is a toolkit that comes with training and resources. And so an employer that's looking to just say, how do we reduce the stigma within our organization? It's just easy to grab and go. And so I think just know that, because part of our goal today is just to let people know there are tools available to address all those concerns that Marna just touched on.
Yeah, that's so great to hear. And thank you for some of those examples. You use this word stigma, and I think I use it in the intro as well, but I want to dive into that a little deeper. So off the bat, maybe just talk about what are we talking about? What are some of the stigma that surrounds mental illness, and what should we be on the lookout for?
Sure. Yeah, you're right. Stigma is about silence. It's about stereotypes. It's about a negative view of a human being because of a condition or a set of symptoms they're experiencing. And with mental illness, as well as substance use disorder and overall mental health, we can document there's a lot of stigma. So that stigma shows up as beliefs around mental illness not being very common, or around believing that no one else has ever experienced this. There's also a lot of negative stereotypes about people with mental illness. Just pause for a minute and think about how mental illnesses are portrayed in the media, in movies, on the news. So the misconceptions are deep. What's really important is that stigma affects communities because it really can lead to fear. It can lead to silence, and it doesn't lead to creating a caring community that can provide the resources and the connection points that people need. We've also learned a lot about stigma through a survey statistically valid survey that we've done at HealthPartners around stigma. So we know that in our survey of 9 metro and rural counties in Minnesota, that 9 out of 10 people tell us that stigma is a problem, that it keeps them silent, that it's really a barrier. We also have been measuring the level of stigma in our communities, and we've seen some slight improvements, which we're thrilled to see. So we believe it's really important to keep the work going to reduce those negative effects of stigma.
And from a business perspective, I want to touch on something that Marna already said, but it cannot be lost, which is in the absence of clear understanding, people will be quiet. So as a people leader, if you're a manager and you don't understand mental illness, mental fitness, mental wellness, the whole gamut, you'll see something and you'll shut down. And that really ruins the performance of companies and undermines the performance of teams, because the moment when people might need help is when we as ill-equipped leaders shut down. And it's not just on leaders, it can be colleagues too. And I think this is why these campaigns are not just for leaders, they're for the entire organization. But there are unique things that leaders need to also own as part of their ability to change a culture that ultimately is about, just like we think about training an employee to be, effective at their duties, we also need people to be trained and able to access those benefits and resources so that they, as a whole human being, can be effective.
That's interesting. And that's you're providing such great context in terms of the approach that's needed. It's not really, it's not just the person, not necessarily the person who's like has mental, health issues. It's not necessarily like their leader. Like it really is developing that whole community of knowing how to support one another in order to make us all, better. We kicked off the episode, just talking about the stat and the increase in mental health and behavioral requests. Your work has been, predates the pandemic. I mean, what kind of things have you seen in the last couple of years? Have you seen changes in terms of the types of requests you're getting or increases in the types of requests you're getting?
Yeah, I'll jump in on that. So part of the area I lead includes our EAP programs, our digital cognitive behavioral therapy solutions, and I partner with our behavioral health departments. Here's what we're seeing. We're seeing double to triple the number of people reaching out for counseling via employee assistance programs. We also, though, not only have your usual 3 to 6 appointments services, but employers are offering now up to 25 appointments to their employees via EAP, because we know that there's an access issue across the country where there aren't enough therapists always available in your neighborhood, but EAP could fill that gap. So we see employers responding to this huge surge and going with it. We're seeing people reaching out for coaching and support at double to triple the level they were pre-pandemic. Not always showing up because of depression or anxiety, but very quickly we will see that that's a core issue that they're wrestling with. We see people using, one of the things we launched was digital cognitive behavioral therapy. And I want to take a moment on this. People think you have to go see and be in person with a therapist to sometimes see improvement in your condition. One of the amazing things is some of these new digital technologies that you can, literally do on a phone and not with a live human being have the same efficacy as meeting with a therapist 8 to 10 sessions. So if you spend the time on a week-to-week basis using these digital tools, if you're the right person, it can have a huge positive impact for a lot of conditions. And we're seeing people grabbing it. And what's also exciting about that is there are people, because of stigma, who will never go see a therapist, but are willing to, in the privacy of their home, their car, wherever they are with their device, use these technologies. I would be remiss to also acknowledge claims are going up as people seek care. FMLA rates for mental health and leaves of absence are up significantly 2 to 3 times. And I could just go on and on. So that's what we're seeing. And it's literally anything that's touching mental health we're seeing an increase in utilization. And I want to say this, there's a piece of that is good news, and is that people are using these resources. And I don't want that to be lost, because one of the misnomers about running a Make It Okay campaign and running these programs well is you're going to see your claims go down. Actually, this is a place where you want to see your utilization and claims go up because people need to seek care in order to get better as fast as possible. So I just want to say it's good to see some of these trends in many ways.
That's great to call out. I love that, Joel. I love the use of technology. And like you said,
I did too.
It's good to see the ease of access to get the help that people need.
Well, and that one solution is not necessarily for everybody. I mean,
Right,
it's just like
right.
a lot of things that we talk
Right.
about in this show, like personalization and the need to really meet people where they are and have
Right.
a lot of different solutions. And one of them, you know, is the right one.
Yeah. And it's interesting you say like you want to see an increase because that means people are being proactive and getting help. Right. And I think one of the things that we started off, I go back to the word stigma, right? While we're seeing this increase, this 100%, the stat that we throw at the beginning of the call and some of your commentary too, Joel, there's more people accessing, but we still know there's a lot of people that are still, because of that stigma, not speaking up. So my question to you is, again, if I put myself in the shoes of an HR professional, as an employer, how do I make sure people feel comfortable or inclined or the ease of access to if they have mental illness issues and they want to seek help? What can employers do to make sure it's easy for them? In addition, maybe some of the things you've already talked about.
Marna, do you want to talk about a couple of campaign issues? And then I want to talk about some practice issues, if that's all right.
Yeah.
Absolutely, Joel. There are some key messages that we know are effective, whether they're delivered by the HR professional, manager, or a close colleague or friend. They are this: mental illnesses are treatable health conditions. We stop stigma by starting to compare mental illnesses to how we respond to physical illnesses. So we train people and have people think about, okay, how would I respond if this person was approaching me about diabetes? Well, this is a health condition. How would I respond? That seems to be a great level setting place to start. Another really important key message is based on misconceptions that people have. People with mental illnesses or symptoms of are not exaggerating. They're not making it up. That we don't, again, back to the analogy, we don't assume that someone's making up their hypertension, that these are real treatable health conditions that happen to have behavioral symptoms associated with it. The other piece is just really how common mental health conditions and concerns are. 1 in 5 adults is the national statistic. We also know on a community level that the amount of anxiety, depression, and other conditions has increased dramatically during the pandemic. And so, again, whether we're in a workplace or not, reminding people they're not alone, reminding them that, none of us are feeling our best right now, likely, and owning that. So it's common treatable health conditions and that the symptoms can be better understood. I'd really love to hear more from Joel on other insights he has on the practice in an employer setting.
So one of the tools I didn't talk about is having a really good health assessment, which is a questionnaire. And in mental health, this is really important. Because of the stigma, there may not be claims to show an employer the actual needs of their base, but people will disclose in a confidential health assessment answers that help us identify them as struggling. And in fact, pre-pandemic, 35 to 40% of the population in most employers were dealing with some level of a mental health issue, severe stress, severe anxiety, depression, etc. That's up to over 60% in many employers today, sometimes 70%, in particular in education and healthcare, 2 industries where it's really pronounced. So what can employers do? So one, it's talk about it. One of the things Marna just did is really important, is reminding people it is treatable and it is normal. If you sprain your ankle, you know that the person's got to go to PT to rebuild those muscles in time so they can return to work. We need to recognize that a lot of mental health issues are treatable and will pass, or they're treatable and manageable. But if you don't manage, they do get worse. And so we need to support people, just like Marna said, who may have cancer, going to chemo, same with a mental illness that needs treatment. And for that to work, we need to make it okay for people to talk about it, to disclose it with their teams at work. So employers can train train managers. And I think this is a really important thing. As an HR leader listening to this call, you're going to probably have people come to you and say, I don't know what to say if somebody discloses this to me. Because as a leader, you don't want to say the wrong thing because then you get fired. And so one simple thing you can do is really train every leader how to refer someone to your EAP. And part of that is making sure that you know what your EAP delivers. So let me give you a concrete example. The EAP program that we run has a lot of tools in it, and most people don't realize it. So if someone's really stressed because they have an elderly parent who is just declining and they need to find a better nursing home or something, they need two things probably. They need that EAP support for finding care that a lot of EAPs offer, but they also might need counseling to deal with the stress of watching their loved parent decline. Talking about the EAP as two tools, not just called EAP, but really equipping it and helping leaders say, hey, I care about you and I don't want to invade your privacy, but I also can tell you that you're suffering and here's something that can help you. And here's a couple ways because you told me that your mom is ill. Like just showing kindness with specificity isn't invading their privacy. And if they are trained to it and it's coming from HR, how to train, you remove the risk to the leader for showing that they care. So I think that's a really important practice that we need to have with employers. Two, you know what? We will often talk about those great employees who, while they had cancer, still, showed up, or, they went through a tough time, or, I was one of our communities that we support got hit by a tornado a couple of years, and people showcase the employers who when their house was destroyed, they still came and took care of. When do we start doing that for people who are dealing with mental illness? There are so many leaders who are successful and have a mental illness, like post-traumatic stress disorder, like a long sustained deep depression. You can be successful as a human being and have a mental illness. And we need to have leaders share their own story, not only of maybe what they had, but how did they work through it? No different than how they are addressing those physical challenges and life challenges that come up. So those are a couple of quick practices. If we have time, I can talk about more, but I think it's really important to make sure that people know the specific tools that are available to them and their benefits and otherwise their wellness and healthcare programs.
No, that's perfect. That's great advice for employers too, about some things they can do. So, I was going to ask the question about just, what kind of things should we watch out for even in ourselves in terms of characteristics that we need to be aware of. But I'm just guessing that we're probably not all that good at self-diagnosing. It really comes down to even diagnosing even with each other. What kind of things should we be watching out for in ourselves and each other?
Yeah. Well, I'm glad you asked that because I think that's part of the process. Part of the process is thinking of this like we would another condition and learning more. Think of how much people spend time on WebMD learning different conditions. It's good to find out more. What does it mean for someone to have an anxiety disorder? What are the signs and symptoms? So part of making it okay is getting educated on that in a pragmatic, respectful way. But really, you hit it. That just like another healthcare concern that we wondered, there's a change in this part of my body, or there's a change with my mood. This is the time to seek professional support, whether that's seeing your general healthcare provider and saying, I'm not feeling like I usually did, or I'm experiencing these symptoms. Those symptoms are numerous, so I don't want to lay them all out, but anything behavioral, feeling down for a longer period of time than usual, symptoms of anxiety or unsettledness, symptoms that feel like a heart attack that could be a panic attack. Those are just a few things, remembering that our brains and our bodies are connected. So some of those symptoms may be physical. But again, I think the important call to action there is to really have people feel open and ready to ask for help, to have that assessed. Because that symptom could be a symptom of a lot of different things. And it's good to get that guidance and care.
I think as an employer, one other quick thing is that many employers use engagement surveys or use other surveys to find out how do their employees feel about work. And there are a couple of questions that can be really important to look at. Some are, do I like my place of work? Do I find purpose and meaning there? Would I recommend the place that I work? These kinds of questions can show employees' satisfaction with that work environment, but also can it point to other indicators more broadly, and that where an employer can play a role in connecting them to their purpose and what connects them into their team. So I think that's a piece of it. The other thing, though, is in that health assessment questionnaire, one of the most powerful indicators is how do you see your health in 5 years? And one of the most powerful things that we know is how I see my health in 5 years is one of the most powerful and accurate predictors, more than all of my biometrics and everything else. It's my attitude. And so when I'm predicting that, yeah, I'm going to be declining because I'm going to be 5 years older, we need to unpack that. Why am I not feeling optimistic? So that optimism or lack thereof is also another indicator from an HR perspective of what can we use our solutions to help nurture in a person. There's culture, there's destigmatizing, there's that sense of purpose, sense of mission, etc.
I love it. Wow. I'm overwhelmed with all these great ideas. Like, I think things that if they're not doing right now, and then leveraging what they're already doing and maybe actually looking at those answers in a way as predictive. This has been fantastic. Before we wrap, I also want to talk about, and maybe you talked about the state of Iowa, but are there any other, what you would consider, like, what does success look like for employers that want to roll out a program? Any examples that come top of mind that maybe our listeners would say, oh, that's really cool, I might want to emulate that or try to roll out something similar?
Oh, there are so many. Let me just give you just a couple.
Sure.
One that really comes to mind is a large window and door manufacturer in a region nearby. And they rolled out, again, a multi-level Make It Okay campaign and had great success. It's a predominantly male manufacturing environment, and they were noticing really low EAP usage and some indications that they hadn't created the supports for people to get the help they needed for mental health concerns. So they did everything from home mailings to mandatory trainings for their managers to help them understand how to support their employees. They also had, interestingly, in the middle of that campaign, a leader came forward and said, I've been at 2 of these sessions. I need to come tell my story. And so this HR leader actually told her own story at the rest of the presentations and really made a big difference. So we could watch it happen in real time. And we could watch the impact, like Joel said, of her sharing her story.
Well, what a way to take away the stigma as well, right? Like,
yes.
by having someone in a leadership position do that, I think that
Exactly.
is very telling for the culture of the company. That's great.
It is.
Yeah, and so whenever you get those stories is powerful. And I think one of the other things I would just say to HR leaders is, again, don't look for claims to go down. Look at your value indicators to go up, because you'll see that your turnover rate can go down. Your injury rate can go down. There are things that create improved performance and productivity that while your claims may go up as people are seeking care, there's a commensurate improvement in those other really important indicators as an employer. And so I think, and they save you money. And I think that's a really big deal, is those other indicators are money generators or money savers. And so it's not just about claims. So think about the value of the investment in total.
Yeah, I love that insight. Like I said, wow, lot to absorb, a lot of great stuff. What did we miss though? Marna, Joel, I know we hit a lot of things, but if you were to leave our listeners with one powerful takeaway nugget that you want them to kind of absorb and, maybe take back to their office or to their leadership, what would that be?
Well, I have 2. One is, please visit makeitokay.org. Go there, and there are free resources. You can participate in a virtual training. It's all laid out. Go there, and we'd love to see you and learn more. And the second is to remember that we've been speaking a lot about the stigma of mental illness and mental health. We all have a state of mental health. So we can all take a role in being more open and transparent and caring in how we speak about that as well. Not only diagnosed conditions, but also just our general sense of mental health and well-being. I hope that that will be a positive outcome after our last few years, and we can all play a role in that.
And then I would just chime in and say, whether one has a mental illness or is just having a bad day, there are a couple things we know. Go for a walk and take 3 deep breaths. These are mental fitness practices. And we know that, walking, when you have the ability to walk, is just poignantly and powerful. It is a very powerful antidepressant, anti-anxiety, anti-PTSD medication, going for a walk. And 3 deep breaths, quieting your mind and slowing down, they measurably reduces the stress that's in your heart and in your blood and your blood pressure, and it has a huge impact on your mental and physical well-being. So if there's 2 things, go for a walk and take 3 deep breaths every day or as often as you can.
Yeah, so good and so simple. And you know what? I've taken that advice. We live in, Hayden and I are based out of Fargo, and in the winter, it's really hard to take a walk outside. But this week has been the first nice, and I remember the sun was shining and I went for a walk. And I just remember how much it just kind of resets your whole self. And I'm sure it helps with burnout and focus and mental illness and all those things. So I love something as simple as just, taking time to do those things, while small, can, as you said, Joel, mean so much. So, wow, this has been a really enlightening
very
episode.
valuable. Yeah. Constantly writing stuff down as we're talking.
I know. And we'll make sure to include the Make It Okay URL in our show notes. Thank you so much for advocating for that. We'll make sure that we do that. And again, if you're listening, check it out. Free resources. Who doesn't love free resources?
Right.
So Joel, Marna, thank you so much for coming on the show. We really, really appreciate it. Tons of value. And I know our HR listeners will thank you for what you shared.
We were glad to be with you. Thank you for the time. And we're glad that you're all committed to this. Thank you.
Yeah, and thank you again for really talking about this issue in particular, because there is a lot we can do, but it's not going to happen if we don't do it. And you have allowed us to get more people working on this campaign and in this area. So thank you very much.
Yeah, we're happy to do so. If there's one thing we can hope after the pandemic is that, there's so much focus on the importance of this, and what was maybe not talked about as much has really been a spotlight shown on it. And I hope that these episodes and more of the work that you're doing with Make It Okay, we can really make an impact. So thanks so much. We appreciate it. Take care.
Thank you.
Thank you.
WEX is in the business of simplifying benefits for everyone. Now, although we certainly hope our podcast sparks some aha moments, like that was pretty cool, but of course we cannot provide legal, investment, or financial advice. And, therefore, nothing shared in this podcast should be interpreted as such. We encourage you to seek out appropriate professional advice regarding your plans. Hey, congratulations! You made it through our disclaimer. Thanks for listening.